If a man is using drugs, he is simply ignored by the society. But when it comes to a woman who uses drugs, she is hated.
बस मैं ये जानना चाहती हूँ कि हम नशा करते हैं तो इसका मतलब कि हम सबसे अलग हैं।
According to our research, almost 80% of the women living with HIV who lost their life in Lahore, they belong to the group of women who used drugs. That clearly means that we need to have services established for these women, and their needs are not being met within the existing service delivery package.
And a bigger problem that we have to look at is the severe lack of access to sexual reproductive health services. We have seen women who use drugs dying in hotspots after giving birth because of severe hemorrhaging. We have had cases of death where our community members, because of the lack of financial support, have gone and taken huge risks with unsafe abortion and have ended up with either the problems are lifelong or they have unfortunately just passed away.
अभी जो मेरे ये कॉपीडी लगी हुई है, मेरे को जो मेरे कॉपीडी मेरे हॉस्पिटल में, उसके बारे में जो जानकारी हमें चाहिए होती है वो जानकारी ना देते हैं, ना ये पेपर में लिखते हैं।
Ever since I involved working in harm reduction program here since 2011, I've learned the hard way that there's zero specific data that actually formally reported or highlighted about women who use drugs that includes self-acclaimed women who use drugs. Such condition clearly shows that awareness, knowledge, even talks around sexual reproductive health rights and other critical issues will remain unnoticed, taboo, and stigmatized.
Can we say that we actually have any specific services for women who use drugs? No. We have around 8 countries who are our members at the moment of this collective. And one thing that we all see in common is that there are no gender-focused, women-specific services. We are expected to very conveniently just adapt to the services that are existing at the moment, which, of course, as we all know, are totally male-centric. So this invisibility is a very huge problem. There are women who use drugs in every strata of society. But what do we do to bring them in the open? And why is it so difficult for us to actually admit and accept that the community of women who use drugs are also a group of individuals who suffer from this illness, and it should be treated like a disease and they need to be provided a treatment for it. But if I cannot even access something as a simple buprenorphine, the opioid substitution therapy that we are supposed to get as drug users, then what's the point in having the whole harm reduction program?
To us, Women Use Drugs is a very important initiative where we are expecting to have established an effective network of service delivery for sexual and reproductive health services for women who are using drugs, especially in Lahore where we are based and providing services for HIV and AIDS prevention to the marginalized groups of women. We have identified 3,500 women who are using drugs and living on the streets. These women are delivering their children on streets. Many of these women and their children die because of the unavailability of prenatal and postnatal care.
This collective is also born as equally important to address the awareness aspect of sexual reproductive health services and justice, as well as promoting open dialogue more on sexual and reproductive health and justice and our rights. Of course, we do have kind of a work plan that we would like to follow up in the future. However, as of now, we are focusing on the collectivization, on encouraging new groups where there are none, forming unofficial, informal groups of women who use drugs so that they can come together in their respective regions and start being a kind of a support to each other.